Deputy Healy.
Taoiseach, from 2002 on, successive governments have espoused and implemented the downgrading of hospitals and the transfer of acute hospital services to so-called centres of excellence. We all know that that policy has created chaos. It was wrong then and it's wrong now, and it should never have happened. We in South Tipperary were lucky that people power, 15,000 people on the streets, stopped the transfer of our services out to other areas. But other areas weren't as lucky. And Taoiseach, it's now time to recognise that failure of policy and to reverse that policy failure. And the trolley figures are a clear example of that chaos. Those figures, and we're talking about human beings, on trolleys, in accident emergency departments, on corridors, on the wards, are a clear example of the chaos, are a clear example of the failure, and are a clear example of the indignity suffered by thousands upon thousands of patients over the last 10 years. The figures for October, 11,452, are absolutely outrageous, and the figures are climbing year on year. And of course, we haven't really entered winter at all yet. One of the areas that has suffered the brunt of the policy that I'm speaking about is the Midwest region, Limerick, Clare and North Tipperary, part of my own constituency. And of course, there are knock-on effects at South Tipperary General Hospital as well. University Hospital Limerick and South Tipperary General Hospital are consistently among the highest with trolley figures in the country. And indeed, today's figures, Taoiseach, today's trolley figures are absolutely obscene. We have patients suffering and we have patients dying on trolleys in our emergency departments. And we've been warned about that for the last number of years by the Irish Association of Emergency Medicine. Today's figures are the second highest ever. Mary Harney, the former Minister of Health, declared an emergency when there were 602 patients on trolleys. Today, there are 679. The particular problems at University Hospital Limerick and in Clare and North Tipperary commenced with the closure of the accident emergency departments at Nina General Hospital and at Ennis General Hospital. There is now a campaign locally and has a number of very successful meetings to demand the reopening of the accident and emergency departments both at Nina and Ennis. The chaos from the policy that I have described is compounded, Taoiseach, by two moratoriums, and they are definite. They are on the ground. Everybody in this chamber knows it, and so do you.
Thank you, Deputy.
We have a moratorium on the recruitment of staff. There is currently 432 nurses, staff nurses, public health nurses and staff midwives posts vacant. There are over 500 nurse vacancies in the mental health services. There are 3 posts which I know myself personally to be vacant for the last 6 months at South Tipperary Mental Health Services in the CAM service and clinical nurse specialists for mental health services in the A&E in Clonmel. Taoiseach, isn't it time to accept that the policy of downgrading hospitals has failed and that policy should be reversed? And isn't it time to agree to the reopening of the Accident and Emergency Department at Ennis and at Nina?
Please, Deputy,
and isn't it time finally, Ceann Comhairle, to recognise what we all know, that there is a moratorium both on staffing and on home health hours, and that moratorium should be lifted immediately? I have to say I am shocked at the lack of urgency that the Taoiseach displays. Almost indifference. Almost as if this situation is normal. Well, Ceann Comhairle and Taoiseach, the trolley figures are absolutely obscene. We have people suffering on trolleys in our hospitals. We have people dying on trolleys in our hospitals. And Taoiseach, you are the leader of this country. And I have to say that you have a responsibility for this obscenity. You have a responsibility for the suffering, and you have a responsibility for the deaths of those people on trolleys in our hospitals over the last number of years, and a position that continues to this day. And you can solve this problem. You absolutely can solve this problem. And I would ask you now to immediately introduce a supplementary budget to tax the 1% of the very, very wealthy people, the billionaires in this country, who own 27.3% of all the wealth in this country. They are not paying their fair share now, nor have they ever done so. I want you to reopen the Accident and Emergency Department at Nina Hospital and at Ennis Hospital, and I want you to reopen Our Lady's Hospital Cashel, a state-of-the-art hospital which has been vacant for the last 10 years.
Please, Deputy, your time is up.
Taoiseach, you have the responsibility to solve this problem. You can do it. The question is, do you have the political will to do it?
Thank you, Deputy.